Great. Hold on, Facebook's coming. 1 second.
I don't know how you gonna redo that again, man. That was enthused.
I know.
I know. So much energy. I was feeling it over here.
Yeah.
I was like, hey, we're ready.
Yeah. Great. Welcome to the discussion. This episode, we're going to talk with Denisha Porter and her guests about All-In Cincinnati, the All-In Cincinnati Equity Coalition. So first, I got to give a shout out to my co-host, Jerod Lindsay.
Hello, everyone. It's good to see you all. Charles, good seeing you again.
Hi.
Yes, and I am going to kick it right over to Denisha. She's actually this way for me. So Denisha, could you please introduce yourself and also introduce your wonderful guest who I love?
Yeah, of course, my pleasure. So Denisha Porter, and I lead the All-In Cincinnati Equity Coalition at the Greater Cincinnati Foundation. Our whole goal is to uplift Black women in Hamilton County by dismantling racial inequities in our 5 priority areas of health, housing, education, economic mobility, and justice. And I'll say that again because typically when I'm having conversations with people, they're like, what are you doing? So those 5 priority areas are health, housing, education, economic mobility, and justice. And so I've been on the job for a little over a year now, and I'm loving it. And one of the reasons that I love it is because of my wonderful core team. So those are my guests today. I have Eileen Cooper-Reed, and I have Shar Fisher-Jackson on the call too. So I'll turn it over to Eileen to introduce herself, and then Shar can introduce herself.
And Eileen, please don't shortchange it, okay? Don't.
Oh yeah, she's amazing. Mama Eileen, yes.
I'm Eileen Cooper-Reed, and I've just been around the block a few times. So I'm a retired attorney, a former school board member, the former director of the Children's Defense Fund, Ohio, and just kind of a citizen of Cincinnati who, wants to help make things right. That's who I am.
Thank you.
Ms. Shara?
Uh-oh, let me unmute her. There you go.
Hi, I am Shara Fisher-Jackson, and I am fortunate enough to have Eileen having walked me around a couple of those blocks, right, here in Cincinnati. I am a recovering litigator and attorney, and now working for the Cincinnati Preschool Promise, and it is officially my 5-year anniversary of being a Cincinnatian.
Yay!
Perfect. And then you were on recently with us to talk about the Preschool Promise, so we're happy to have you again. Mr. Lindsay.
Man, so I'm just excited to see you all, you beautiful women here. Thank you all for coming. Thank you all for joining us. Denisha, I'm really excited about this conversation. What I want to start with is I would like for you, so actually I'm a little bit confused, right? So when you said All-In Greater Cincinnati Equity for women, right? So are you the director for the women portion, or is it an all-encompassing thing? Can you clarify that for me?
Yeah, so the focus population is women, and we use the whole idea of targeted universalism. So we're not excluding anybody, but the whole idea is if you lift up the most vulnerable population, you lift up everybody. But the coalition is open to any and everyone who wants to get involved. And really what we're trying to do is push forward different policies and system changes in Hamilton County that makes it more equitable. And before I forget though, I do want to invite people to our next coalition meeting. And it's the 4th Thursday of every month. So it's September 24th from 3 to 5 p.m. over Zoom. So if you're interested, contact me and I can send you information.
How would people contact you?
Yes, great question. Through my email. That email is Denisha, DENISHA .Porter, PORTER @allincincinnati.org.
And I think our beautiful tech team of one, which is Mo, is putting that in the chat, I believe.
Yes.
So thank you for that, Denisha. So, and thank you for clarifying that for me. So when was All-In established?
Oh, yeah. So All-In established around 2015.
Okay.
And so it really started with a group from Greater Cincinnati Foundation, United Way, and Interact for Health. And they all went out to an equity summit that Policy Link hosted in California. And they were just like energized by what they heard the environment, the momentum. So they wanted to kind of bring that back. So I believe in 2016, they got together with Policy Link and started brainstorming, like, how can they bring that energy back to Hamilton County and Cincinnati? And Policy Link had this umbrella initiative called All-In Cities. So towards the end of 2016, Cincinnati became an official All-In city. And then moving in 2017, that group really started to work to do like a needs assessment, do interviews in the community, to create All-In Cincinnati report. And if you haven't checked out the All-In Cincinnati report, I truly recommend that you do. It is on our website, and it's on GCF's page. So check that out if you get a chance. And so they worked on that report, and it was released in 2018. And I'll actually turn it over to Eileen, because she lived that whole experience, and she can probably give you a little bit more detail about that journey.
All right, thank you.
Actually, you did quite a good job. Yeah. But what I will say is that, and I know, Maurice, I think you did the Policy Link Equity Conference, so you know how good they are.
Yes,
we came back fired up, actually, because that conference looked like America. And most of the times when you go to conferences, they don't look like America. You know, this one looked like America, and it had every kind of person, every kind of thought, every kind of belief involved. And so when you have that, you know, everybody can feel like they belong. So when we came back, there were about 25 of us. We met, so we were all volunteers in essence, just helped by the staff of GCF, but supported by all three organizations. And
what are those three organizations?
Pardon?
What are the three organizations that fund?
Greater Cincinnati Foundation, United Way, and Interact for Health.
I love Interact for Health, by the way.
Yes, that one you forgot.
We know you love Interact for Health. Me too.
And so when we came together, we actually met every month for a year to determine how do we need to form ourselves, how do we need to organize ourselves to do equity work right here in Cincinnati. And we decided on a coalition because it is much more inclusive than most other kinds of organizational setups. And it also allows for the widest variety of voices to be expressed, right? Yes. But we also decided to have a core team that could really guide the work. And it was people who are involved in community work, you know, like Shara, like myself. So they have the core team, and the core team has guided the work all along. We were so thankful to get Denisha, because before that, you know, it was somebody's additional job. It wasn't somebody's job. And basically we were doing this as volunteers because we cared about, you know, racial equity in Cincinnati. So during the course of working with All-In, they actually did a 120-page data report. That's how we decided to focus on Black women, because Black women were at the lowest category in every one of those major areas. And so if you address the needs of Black women, you are going to lift everybody else up because we're the worst. So it gives you, Maurice?
Yes. So can you share some of those, when you say lowest of the poll, can you share some of those statistics that you're referring to?
I probably can't. Okay. You know, just because they're a couple of years old, and I know it's the case. We can take each one of them, and each group will take theirs. So if the housing does housing, they know the statistics of
exactly.
that. You know, so I don't need to keep those in my head anymore.
Gotcha.
You know, people who are working in that area can give us those.
Gotcha.
So I want to backtrack a little bit, right? So we know equality, right? When we speak on equality, we know everything is equal, the playing field, supposedly, right? Supposedly, I'm using air quotes here. Equality, the playing field, everyone has the same opportunities, right? Let's speak a little bit about equity work. So for those who may not know, can you deep dive a little bit about what equity work is? Denisha, Shar, one of you, could you kind of just give our viewers the landscape of what equity is?
Yeah, so for me, it's giving everybody the opportunity to be their best selves and making sure that outcomes are not dictated by your race. Mm-hmm. And so when you were talking about, like, is it a equal playing field. Like it really isn't. And some people need more assistance than others. And so that's what we're looking to do. We're looking to change those policies that do actually provide more for those populations, specifically Black women, so that they can be successful in Hamilton County.
Thank you for that. Shar, you want to have something to add?
I do, because I can remember sitting around the table having this discussion.
Okay.
And saying, what does equity mean? And I think Denisha has wonderfully explained it. But for me, it was very basic, right? Getting what you need, when you need it, in the way that you need it. Mm-hmm. Right?
Could I add something? That's absolutely right. But could I add one thing to that? There's a difference between equality and equity, and that needs to be clear. Equality means, for instance, that I'm going to give all of you size 10 shoes. That's equal. All of you don't need size 10 shoes. So it doesn't make sense to do that.
Me either.
The eventual outcome is equality, but before you go through equality, you have to go through equity so that you're sure that people are getting what they need.
Exactly.
As Shara said.
Great point, Eileen. Thank you. Uh-oh.
No, I'm here. So now I actually want to go back, right? So we continue to mention the All-In report, right? And when I was reading that report, something stood out. There was a quote that actually really stood out to me. To build a stronger Cincinnati, stakeholders must start with equity. Just and fair inclusion into a society in which all, including every racial and ethnic group, can participate, prosper, and reach their full potential. And I think that really encompasses what equity is and what's required for us in Cincinnati to kind of build equity. Denisha, can you speak about how some of the work that you at All-In Cincinnati, the Greater Coalition or the Coalition is doing to ensure that people can participate, prosper, and reach women, Black women can participate, prosper, and reach their full potential? What's some of the programs that you all have in place?
So some of the successes, I'm getting older, so it's hard to try to rattle them off from memory, but we have been able to put a lot in place. I mean, not only were we able to come together and form a mission and a vision statement, we also were able to come together, and we have about between 70 and 90 people on our calls every month. And some of the policy changes that we've made, we've started with partnering with Kroger. And so prior to the pandemic, there was a policy in place where you couldn't use your EBT card for online purchases. So when the pandemic hit, we really wanted to change that because we wanted people to be able to safely access food. And so we worked to change that federal policy. And so now you can use your EBT card online. Also worked with 8451 to overlay Black women in poverty with their food distribution map. So when they were thinking about food distribution and food access, we know that Cincinnati and Hamilton County are huge food deserts, that they can actually put them in places where they're most needed. Recently, we worked with the county, and we are included in their declaration around racism as a public health crisis as an organization to partner with and collaborate to change policies and systems in Hamilton County. So that's first under health. Under housing, we worked with LIST. We partnered with them to create some rental protection policies during the rental and eviction protection policies during the pandemic. And then also I was able to advocate the Affordable Housing Trust Fund with City Council. So I don't know if you know, recently $6 million was allocated to that fund. Also in education.
That's amazing. That's amazing. I just wanna, so yeah, that's amazing. I don't want to gloss over that. So no, that's great. That's great work.
And then also we partner with Dr. Gail Christopher. And so actually we had that meeting at Interact for Health, Maurice. When we brought her in, and she is absolutely phenomenal. So if you haven't heard her speak, I would highly encourage you to just Google her. And read her document. She created the framework, Truth, Racial Healing, and Transformation. And excuse me, and it really just speaks to the fact of having like these courageous conversations around racial healing. So we partner with her to kind of create a model that can be spread into educational institutions. And now most recently, the University of Cincinnati has created a racial healing center. So super happy about that. What's that? So that's health, housing, education, economic mobility. That kicked off in 2019 partnership with the Women's Fund, and they actually were able to spearhead the salary history ban. So creating or putting in place the idea that women can actually better negotiate for salaries, knowing that Black women in Hamilton County typically get 67 cents on the dollar for white males.
Wow.
So giving them the opportunity to negotiate better. And then also most recently, we were able to endorse Yes on 7, so the transportation levy.
Mm-hmm.
Huge. So when we think about increasing economic prosperity for Black women in Hamilton County, how can you do that? You need to get to your job.
Mm-hmm.
In order to do that, we really need to look at the transportation system and make sure that is working for Black women. And then finally, in justice, worked with Iris Rowley. She was able to get the first community site, for testing in Bond Hill with Mercy Health. So super happy about that. Worked with the Urban League to prioritize mask wearing in Black communities. And there's, the collaborative agreement. Yes. We were able to get funding for a director for the collaborative agreement and work on recommendations for healthy policing. So those are all the things we were able to do.
I'm going to go around the horn. I'm gonna take a minute, right, just to digest everything you just said. I have a follow-up question for you, and then we'll go around the horn. When we speak to the salary history ban, in improving that negotiation process for Black women, which is so important, what does that look like? How do we monitor to make sure that it's not just talking, the process is actually being improved?
Right, so it's with the city, and what they did was they banned asking what you made on your previous job. So it's just taken out of the equation.
Okay.
So if I'm telling you what I made on my last job, then it's hard for me to get bumped up a lot more. So that's exactly how that policy took place.
Gotcha. And if someone violates that, you just report it to the city, and then the city will deal with the employer. Is that kind of how that works, essentially?
I think so, yes.
Yeah, okay. Perfect. Okay, Jerod.
Shar, do you have anything you want to add to everything Denisha said in regards to the work that the Greater Coalition is doing?
Well, I think when you think about all of these accomplishments, I think it is what is so compelling about All-In and the All-In Coalition is that there's a space and an opportunity for everyone, right? With the breadth of those issues. And it was a deliberate approach from the beginning to say, this is not going to be just a think tank. This is not just going to be a data repository, but how do we make equity actionable in this community? How do we have measures and things? And you can see how that's played out. If you read the report and you talk about those goals, they're aspirational, they're lofty. But Denisha has walked through and said in each one of those areas, this is how it translates to action. And that is one of the things that I think inspires people to continue to be involved in All-In, right? It is a space where you bring whatever your concern is about equity, whatever your issue is, and you are surrounded by a group of people who are like-minded in their commitment to equity, but also their commitment to action.
I appreciate that. Thank you. She's great.
She does. I forgot that I invited 2 lawyers, and they're amazing.
Hey.
Our closing statements be off.
They bring it home every time.
She's so modest about it. She's like, "Oh, y'all are hyping me or whatever."
But yes. So one thing that actually Denisha doesn't know completely about, but we're working. The All-In is working with Cincinnati Bell and CPS. Because our major strategy was, our major strategy for during COVID was to ensure that every child gets access to remote learning. And so the way we did that was to make sure we were included on the committee that's doing the work, and so we can bring in the issues of equity that might exist, like some neighborhoods don't have fiber optics, so they need to and the bandwidth may be low. So what do you do in those particular cases? Where are you providing it? Where do you know that the need is greatest? And we're really keeping track of those numbers week after week after week to make sure that the children are going to have remote access. I think it's phenomenal, that's happening. It is more phenomenal because after this particular part of the crisis is over, we still need to have internet access at all of our homes, and they still need to be wired. So this is just kind of the lead that allows us to do that and to actually attack something about digital equity that wouldn't have existed before. And last but not least, the other piece about the coalition is that it is the only place where all of these equity issues are addressed. There's no place else that you go where that's happening. So we can actually look at, when we did education last week, the housing committee looked at what in housing needs to be addressed so that children can get a quality education. Well, mobility is an issue. So as you see, if you only do one area, you're liable to push everything else away in some way. So we have a chance to talk about these across the board, because families don't exist on single issues. People don't exist on single issues. And so we're addressing the 5 major issues that confront families in the All-In Coalition.
I appreciate you speaking to that holistic approach, right? I think it's good that we're emphasizing that. Another thing, going back, well, first of all, the fact that you all are able to address all of these things, is that why you have 70 to 90 people on calls? Is that what I heard? Am I right in hearing that?
Yeah. Mm-hmm.
So what does that look like? How long are these calls? Are people jumping in? Like, give us some of that day-to-day behind the scenes.
So I can tell you, let me add something, Jerod. So, first, the very first, these coalition meetings take place at Interact for Health. And then first they
need to pay you.
So at first they started, 30, 40, 50. Then they started growing up. Hey, we need more chairs. I used to have to pull out chairs to fill in. And then, and with the guest that we had when she came, it was probably 90. Yes, that was.
No, it was over 100. She pulled the most. Yeah.
Yes. And she delivered a great speech. But and live in person, all these people will come to Interact and come to these meetings. And I've had them at different sites, obviously, since Interact has kind of adjusted a little bit. But it was amazing to see everyone. The who's of who was there. You have these.
So these were in-person meetings originally.
Exactly.
Yeah.
Okay.
Yeah, so originally they were in person, and they were either at United Way, Interact for Health, or Greater Cincinnati Foundation. And then once we moved to our new location down at Sawyer Point, we actually started having them there. I saw Natasha say in the chat, it's always a great time, and it is.
Yeah.
I would love to make it a wonderful experience for everybody. And it really is. We get to know each other, interact with one another. Our last coalition meeting, we were singing and dancing before we started the meeting. And this virtually, we were singing I'm Every Woman. I just want to make it fun. Life is hard, and this is hard work, but it's not impossible work. And we bring together people who have just amazing talents, amazing skills. And I just feel like once you bring everybody in the room and everybody is passionate about the work, it can get done. And I just want to constantly remind people that we can make progress. We are making progress.
We are.
I'm trying to get a visual of what the room looks like. So I'm hearing 70 to 90 people. Is it only Black women? Are men invited? Or more to go get the chairs? What does that room look like?
It's everybody.
Everybody.
It's everybody. It's everybody who cares. It's everybody who cares about this.
Yeah.
It's everybody who really cares about it and who's willing to work on it. Because this is not necessarily for their organizations where they work, but their organizations are likely to be affected by this. So they come together, and we actually just Denisha, you might want to just tell them what a meeting looks like that way. Yeah, briefly, so he gets that idea.
Yeah, I was thinking about that. So the first hour is a business meeting. So I start off by doing the welcome. I introduce myself. I always introduce Eileen, and she goes through the core values for us, or our guiding values, which I think is so important because it really sets the stage for the meeting, and it identifies how we interact with one another in the meeting. From there, we have a presenter, so a featured speaker, and they present in one of our priority areas of health, housing, education, economic mobility, or justice. And then we do breakout rooms. So at GCF, we actually had breakout rooms for each priority area. Zoom, we actually do the same thing.
Wow.
Okay.
Have our core team members who facilitate those discussions. So Eileen and Shar are actually facilitators in the education subcommittee.
So,
Okay.
I will say that one experience that I think is universally shared is that at every coalition meeting, you'll have a sense of grounding, right? Mm-hmm. When we talk about those core values that we start with, our shared kind of visions for our community, right? For what happens, that is a place that for me, no matter what's going on with organization, hectic, what's happening, it reminds you that this is who your community is. As an all-in city, this is who we are and what we agreed to work together for. And so it's a great way to kind of level out and then get in that breakout room and get the nitty gritty, right? The hard stuff, the challenging issues, the what are you doing with this week? How are we gonna drive this home? What's gonna happen? And there's always time reserved for report back, but there also is a sense of mutual accountability, but also mutual respect to meet people where they are and to say that it is a safe space. So you can say the most off the wall thing. Now people will challenge you, but they won't disrespect you.
That's awesome. That's
Beautiful.
awesome.
People don't
Beautiful. Said it perfectly. Yeah, so the first hour is a business meeting, and then the second hour we break out in subcommittees and we discuss. And it's really the coalition, like, who is moving the work forward. It's the coalition that comes to the table with the ideas. The coalition, like Shara said, like, you can be challenged, but you won't be disrespected. Wow. It's all of that. It's that all of that energy in that one place, and that's how we're able to move policy so quickly.
So it's the people who are doing the work in community anyway that we're bringing, that we're convening. So we're not taking their place. I mean, there's a housing coalition that's a wonderful coalition. We don't need to replicate their work. We just need to put them together with the other people who are dealing in housing. Same thing for all of the areas. So it's about convening the people whose work this is, you know, so that we can figure out how to do it better together as a community.
Right.
I think the fact that, and so again, this sounds like a hub, right? A hub for greatness, obviously, but a hub to push the work together. So what the All-In Coalition is doing is they're just, you all are bringing in the people who are doing, just to repeat what Eileen just said, you're bringing in the people that are already doing the work. You're giving them a space to discuss this work and to move the work forward, and you're helping facilitate those conversations. Is that accurate?
Yes, beautifully.
Okay. Denisha, how was it brought upon you? How did the director position come to you? How did you get this position?
Excellent opportunity to tell us a little more about
my past.
Yes.
So it came to me because, well, I've spent most of my career at the health department. And so there I led a Creating Healthy Communities Coalition, and it was focused on anti-obesity work. So healthy eating, active living, and tobacco-free living. Really a lot of health equity work. And so in that role, I was there for about 10 years leading that work, had several different policies and systems and environmental changes. I think collectively that coalition moved over 400 policy systems and environmental changes in Hamilton County. But thanks, Maurice. Thanks, guys. But what I found when I first did like the community needs assessment, it was like everybody thought health should be prioritized as the first thing, but they were also worried about all these other challenges or what's known as social determinants of health in the community. So it was like, yeah, I want to worry about my health, but I also want to make sure that I have a job that I can actually afford to take care of my family. So whether that's working overtime on my first job or working 2 jobs, like I'm gonna make that happen for my family. Or it was like, you know, I'm worried about education. I'm worried about my children being able to go to the best school possible and get the best education so that they can be successful in their life. Or it was, I started at the health department as a sanitarian, so I know doing housing inspections that Cincinnati has an older housing stock. And so some of the challenges that comes with that, like making sure, you know, lead and mold and those types of things are taken care of. So make talking about housing, making sure not only they have affordable housing, but healthy housing. And a lot of times when people were asked about physical activity, they're like, yeah, I want to get outside in my neighborhood and be more physically active, but I'm also worried about the violence that's in my community and worried about the safety in my community as well. And so I found myself like being pulled in all of these different directions and being on all of these other committees because I really wanted to solve some of these challenges so people could really think about being their healthiest self. And so with all of that work, when this opportunity came up, I was like, this is perfect. Because like Eileen said, for the first time, it is the only space where all of these things are looked at comprehensively, and we can make policies not only looking at whatever lens that policy may come from, but also looking at other lenses and seeing what that perspective and what can be brought in for that. And so I just thought it was an amazing. And then just to come in and be so celebrated, so supported by the core team, they poured into me. Like when I say like they are amazing, like I cannot say it enough. Like I was gonna say these women, the majority of the core team are women, but we do have some in the core team, but they all are like experts, like true experts in their field, and what they bring is top. Top. It just can't get any better. So yeah. I was just super pumped to do it, and so hit the ground running and started making changes.
Right. We appreciate that. We appreciate that. Shar, Eileen, can you all kind of give us some insight on what it's like working with Denisha?
Work with Denisha?
Yes.
Yeah.
So I tell the truth.
Spot. Did I put you on the spot?
Right.
It's wonderful. It is wonderful. It's wonderful because she's right. The reason she was chosen for the job, it's not easy to run a coalition
at all.
And you really have to know how to do it well. Everybody has not run that. So if they say they're going to and they haven't, they really don't know what they're stepping into. The good news is Denisha did, because she had run a coalition for a number of years. So she knew what the work looked like, what it felt like, how it needed to be distributed, and what kind of support she would need. And when she decides she needs support, she knows that she's going to come and ask for it. And she also knows that she's going to get it. And that's the kind of person you want leading an effort like that, because you don't want someone who gets stuck and won't say anything and won't use the resources that they have. She does have some magnificent resources to draw from, and she knows exactly how to use them. I did have to tell her I couldn't be on every committee. I was only going to be on 2.
Just two.
On every committee. Pardon? She was trying to get you on every committee.
I think I had her on 4 or 5. So not every.
not the subject area committees. These were more operational kind of stuff, No, but no, she runs it well. She organizes it well. There's nothing, and I always remind her that she does have us, and she doesn't have to do, because she's one person. So even though she knows how to run a coalition, you need a capacity to be able to do that. Certainly. So I'm the one that reminds her to say no, and also to ask for help. And she does that. She doesn't always say no enough, but we'll get her there.
And Shar, before you answer, I want you, because last time we had you on, I don't think we talked at all about your position at Urban League. And I think that your experience there really helps this work as well. Can you talk a little bit about that before you
Yeah, so I was fortunate enough that I came to Cincinnati because of the Urban League. And I came to Cincinnati the week before the 2015 report, The State of Black Cincinnati, was released, right? And so that was kind of my charge. And the Urban League is the quintessential organization that says they have a national footprint, they've had a local presence for decades, to be able to say, how do we do this equity work in an urban environment and drive it forward? So being there as working with the Greater Cincinnati Urban League, being the interim CEO, really gave me the foundation and footprint to introduce me to Cincinnati that says, how do I get ready? right, to talk about equity. How do I look at the data? How do I get engaged to the community? And it was the best opportunity and foundation I could have ever had, right? Yes. And happy, Eddie's doing a fantastic job. The team is growing, expanding, and I will always be Team Urban League. But now I'm also Team Preschool Promise.
Preschool Promise, there you go. There you go.
And what I will say about working with Denisha is that she is inspiring, right? And she's motivating. And I feel like I always get so much more than I give, right? And I remember when she first came on the job and she set individual meetings with each one of us. And she came to my office at the Urban League at the time. And she said, well, what do you think? And we talked about it and where are you and what was your journey? And then she said, now, what are you going to do? I said, oh, that's very interesting. What are you prepared to do? And that's what I appreciated, right? Because it's easy to sit and pontificate in a lawyer way about how great everything is and what do we need to do. But at the end of the day, what are you going to make happen, right? And that's even more challenging in a coalition environment. And she does that effortlessly, right? She does it with grace, but she does it with facts and information in a way that really makes being a core team member and a coalition team member so easy.
So we transition right. Get your flowers, Denisha. We're gonna get you. Yes. What are your difficulties, Denisha? What are some of the challenges of running this coalition?
Well,
no challenge.
The one recent challenge that we had was actually trying to transition to virtual from in person. Mm-hmm. So and really, I'm not a virtual person. Like, I'm not on social media. Like, that is not my thing. Like, I like to meet people in person. I like to talk to people in person. I like to give hugs. I like to do.
I miss those hugs, by the way.
I know, right?
Yeah, right.
So, like, to me, that was the biggest thing. But I will say that although that's not really who I am, I have found value in being in this virtual world. And so I have found that you really can still have that you can still connect with one another in this virtual world, and you can still move work, because that's what I was really concerned about. I was really concerned about, were we going to able to create a structure where people still had the ability to be honest and open about different things. When we were meeting in our rooms, like, people really were vulnerable and did really discuss the best way to strategize on getting things done. And I was concerned that might not happen in the virtual world, but to my shock, it has, and it's been going really well. So that has been one of the newer challenges. Other than that, like I said, coalition work is hard work, but it's not impossible. And I feel like as long as your heart is in the right place and you're passionate about the work, it can always get done. And there's many ways that it can get done.
Say that last part again. I didn't hear you.
I said it's I told you I'm getting older.
But it's hard work, but it's not impossible work.
Yeah, it's hard work, but not impossible work. And as long as your heart is in the right place and you're passionate about what you want to do, you can get it done. And there's multiple ways to get it done.
I appreciate that. I appreciate you sharing that. When I think about equity work, I think about the barriers, right, to equity work. Because I don't believe, and this is a personal opinion, I don't believe everyone wants to see equity work done, right? Do you ever encounter barriers? Is there ever, whether they be physical, right, or whether it's right in your face, or whether there are any type of barriers that you may encounter doing equity work from the systems that are already in place, if that makes sense?
And can I add one thing to that as well? With the protests, with the death of George Floyd, Breonna Taylor, Ahmaud Arbery, and others, how has that kind of impacted? Where we see organizations being more willing to say, Black Lives Matter, right? I mean, I watched the NBA game and it's painted right on the court. Black Lives Matter. Uber has a billboard that says, if you tolerate racism, delete Uber, right? We haven't seen this before. I mean, at least I know we haven't seen this, organizations coming out with this. To add on to what Jerod said, can you talk about how that's impacted the work as well?
I think people are more engaged than ever to do this work. And as far as what Jerod was saying, though, I think, you know, there's always people who are going to say no. There's always people who are going to say yes. And it's just up to you to find those people that are going to say yes. And so I think it starts with having that just open attitude, that open mindset. Like, okay, I may get a no, but I know if it's true in my heart and it's something that I really want to accomplish, I'm gonna figure out a way to do it. And the universe is good at bringing you the people that need, or that you need to get the work done. And that's always how I've lived my life.
So I'm listening to you talk, and I'm hearing Shar and I'm hearing Eileen sing your praises. And when I asked you about your difficulties in regards to equity work for Black women, right? For Black women, equity work, which is, I can't even describe how difficult I would assume it is, right? And you tell me, you know, probably the most difficult thing is transitioning to virtual. So and then I listened to you talk, and I see in the vibe that I'm getting, you see no barriers. Like, you see no barriers. Like, there is a drive that is upon you. And I just want to acknowledge that, like, that we're going to get it done. Whatever the work is, we're going to get it done. So I just want to let you know, I appreciate that, just because as a Black man, right, who has a Black mother, Black sisters, to see you Black women in this space, right, exuding the confidence and the drive and the will that you all have, it's refreshing for me. I know it's refreshing for Maurice as well, right? Exactly. So I know we're getting towards the end of the hour, and we're respectful of everyone's time.
We got 15 minutes.
Okay, cool. Man, I've been having technical difficulties out. We're not going to talk about it.
Hold on. Let me ask the next question. Is it an Apple product?
It's not it's a Jerod thing. It's not an Apple thing at all, bro.
I think it's an Apple thing.
We're not going to do that. There was another statistic, right, that the region's economy could see a $10 billion per year boost if minority residents' income were comparable to their white neighbors, right? Is there something, I know you all are doing a lot of work, but is there something in particular, other than the salary history band that we spoke about previously, that is being done to provide comparable wages for minorities and Black women? Anything that we're missing?
Were you going to talk, Eileen, or do you?
Yeah. I can, because what you're talking about is an upheaval in the way the economy operates, period. And so because Black women are at the bottom of that, making an impact there is likely to help everybody, right?
Yes.
You know, so I think they're much more than the equity coalition. We do have an economic mobility subgroup that is developing strategies to address that. But that's probably the hardest thing to address, because it becomes whether or not people can basically function and thrive in the local economy. And that's a hard question to answer. So it's going to take a lot more than just even us developing strategies, because it takes the people who employ folks in particular, it takes the HR folks. So it's going to take a lot of us to come together to address that particular issue. What we were doing is letting folks know that how prosperous the region could be if we actually tackled that issue, you know, and tackle it wholly as a community. So for me, that's a longer term piece to address. It is not something that's going to happen overnight, but COVID has helped to pull the drapes back in a way that nothing else could have in terms of unemployment and people being unemployed. We know who's unemployed. It's us again, you know, and so addressing the results of COVID is going to have to be a part of how we actually address that issue. Go on, I'm sorry.
No, I apologize. Just to follow up. So is that an issue that the coalition would address, or is it that the coalition is addressing the other issues below, and by default that issue will get addressed?
Yeah, I'm not sure that that's the way things work in the community. You know, okay. I think what we do is we take a look at what strategies can we develop, and then who do we need to get to help us to work with us on those strategies, and then come together. This is going to have to really be addressed by the entire community. What we believe, though, is that it works from the ground up better, because it hasn't. Because normally it's been from the top down, and the All-In Coalition is from the ground up. And so change happens on the ground. That's where it happens. It doesn't happen up in the sky or even in organizations. It happens on the ground. So focusing on the ground helps us to ground ourselves and to gather community in a way that we can address the issues of economic mobility.
Anything to add, Shara, Denisha?
I think one of the things that we're looking to do right away is really to support Black businesses and specifically Black woman-owned businesces. That's one of our most immediate strategies, specifically right now during the pandemic, and also work with child care centers too, who were hard hit during the pandemic.
And so that's,
there you go.
Right. Damn.
My setup. I'm so good at the setup.
Pass it over. Right. She is.
Is that, as Eileen said, COVID has required most of the country to have a very careful look at things that they, for a long time, chose to ignore. And one of those things is the context of early childhood education and how important it is to make everything function, not only to make healthy, happy kids, but also to drive the workforce. And when we look at the Cincinnati Preschool Promise, it was a commitment to make sure that kids were kindergarten ready, right? And what that looked like was making sure that it was accessible and affordable for families to go to kindergarten, and that the places that they went were high quality and well supported. And what we had a laser focus on during the pandemic too was the majority of family child care providers, the majority of early childhood education staff members and owners were African-American women who weren't making living wages, right? Who struggled to survive, right? So we had to talk about, what does that business model look like? Because if you don't have early childhood education and preschool and childcare providers, adults can't go to work, kids aren't ready, they're not going to be successful in school, and they're not going to be the workers of the future, right? So it goes across economy, it goes across, the equity lens of that, it goes across education, it goes across mobility, it goes across housing, because where you live and your access to housing may be in a place that is a quality desert or a quality gap area that doesn't have any high quality preschools, right? So an opportunity to say, how does all that look? Right? We have 200 providers that we support, that our commitment was we were going to make sure during this pandemic that we didn't have a single community provider that had to shut their doors and go out of business. That was a commitment that our team made. And whatever we had to do to make that happen is what we were going to do. And so now everybody has seen that and been able to contribute to that. So we can get back to the role of educating, right? And building business while we educate, because they have to thrive and survive as small business owners and entrepreneurs to be able to educate the kids. And so I will say, I would be remiss if I didn't say the Cincinnati Preschool Promise with CPS will be back on the ballot this year, issue 17. We're asking everybody to support quality education for Cincinnati kids. Vote down that ballot on 17. And at the next All-In Coalition meeting, you can see the impact and outcome and hear about some of the things that high quality preschool has been able to do, the difference that it's made for the kids that are most at risk because of the economy, because of where they live, because of access to their parents' education, the benefits and the difference it makes for their math levels, literacy levels, and how they start kindergarten ready and school ready, sets them up not only to be on track at 3rd grade, not only at 8th grade, but for life, right? So I can be a preschool promise commercial all day long. Won't raise your taxes, issue 17, quality education Cincinnati kids, but we'll be talking about that a little bit more at the coalition meeting to say, these are the specific data points and what it looks like in this community. And also, what's the challenge, right? How are we going to retool and pivot to say, how do we keep doing this and how do we do it better?
Yeah, thank you, Shara. Jerod, I got a question I wanted to ask as well. So, I was reading the newspaper, and I seen that there's a grocery store. We talk about food deserts, right? In Avondale, for particular, big food desert, right? The Avondale Town Center went up, and we didn't see a grocer, as was promised by the mayor when they broke ground. I think Save a Lot was supposed to come in, but they had pulled out. So now I know that GCF and some organizations have partnered to fund a grocery store in Avondale. Is that something that the coalition can we talk a little bit about that? I know our time is running a little low, but I wanted to mention that.
Yeah, so they have decided to do that, and
okay.
is something that I'm going to be bringing to the coalition to let them know as an update. We have not talked about food access specifically, other than the policy that what we did with the food map with 8451.
Right.
But it does continue to be a problem, and this I feel like is a great step in the right direction towards addressing food access issues within Cincinnati.
Gotcha. Eileen, Char?
That's as much information as I have, and because we do a couple things. We have our own strategies, and then we address opportunities that come up and decide whether to endorse them and work on them as well. So this will be the first time we have addressed it as a coalition. So it stands to reason that we'll be able to do something related to that. Some tactics more than strategies related to that.
Gotcha. Okay.
But super happy about it. I was actually a part of the Build Health grant and was working with the community builders and Children's Hospital back when I was at the health department on it. And so it's for it to finally be happening. I mean, it's like it's time. All it's time, and it's gonna happen. So you made me think about myself in a different light. I'm like, do I not see Barry?
No, that's we need more people like you. We definitely need more people like you.
Yeah,
absolutely. So I appreciate that. Like I took that from me. Like her glass always full. It ain't even just half empty. Her glass. So,
that's right.
That's great.
You gotta live an abundant life.
Yeah, you got to.
Amen.
Right.
So. Well, no, we are. No, this time we're officially at the top of the hour. I'm over here, keep pressing my screen. So again, I just want to, I'm overjoyed, right? These last few discussions that we've had Black women on. I've been super grateful because the Black women that we've had on, I feel like have been some of the most impressive women that I've met. So I just want to say thank you so much for joining. I want to give each one of you a moment to say any last words that you may have to say, and just anything that you would like to add or let our listeners know as well.
How about you, Denisha?
Yeah, I'll start. I just want to give my flowers to the core team again. So I'm going to name them. So it's Kristen Baker, Elizabeth Bartley, Janae Bradley, Amber Brown, Markia Carter, Eileen Cooper-Reed, Michael Coffey, Megan Cummins, Jennifer Ingram, Shara Jackson, Dr. Camille Jones, Chandra Matthew Smith, Rachel Foot McKinney.
Rachel.
Rachel. Iris Rowley, Raquel Smith, Rick Williams, and Ashley Young.
Ashley Young. I love that. She's doing great work at Urban League. Hey, Ashley, if you're watching this, I want to say hi.
And again, thank you to GCF, United Way, and Interact for Health.
Perfect. Eileen?
Listen, working with this group and doing this work is like, for me in the stage of my life, is just wonderful to see all these young people who are dedicated and smart, and compassionate about this work is worth everything to me. I would remind us that while we got to change minds and hearts, because the structural racism is the real issue. Not the individual racism, because people can change, but the structures don't change, then they fall back. So for us to make sure that we focus on those things, but I know that we can, and I'm heartened by the work.
And the one phrase that you say all the time is baked in. It's baked in. I just want you to say that.
It is baked in.
Yes, there you go. It's baked in. So, Shar?
Now's the time. Join the coalition. Don't be limited by what you think it is or what your time is. If you just come to one meeting, be a part of something that will be not only transformational for this community, but for you and the work that you do and advancing what your mission and calling may be. Be a part.
Be a
part.
Young folks.
And we'll share more information on how to get involved as well. So look forward to that. Jerod, any last things from yourself?
I've shared everything. I'm thank you all again. I can't thank you for all the work that you're doing. Like more than anything, thank you for the work that you're doing.
Yes. So I want to, again, thank you wonderful ladies for joining the discussion this evening. It's been a true pleasure. when Jerod and I started this platform, we just wanted to get information out. As you know, when you go to the chamber and some of these other platforms, you have to pay for, people like yourselves to speak about these different things. And we wanted to be able to, due to our relationships that we have with community folks and, folks like yourselves, to be like, say, hey, do you mind coming on a discussion and just having a discussion about it? Less structure, more conversational. And, it's really been a great journey thus far, an excellent journey, actually. And the feedback we've received has been amazing. Shara, I can tell you the feedback I got with the preschool promise recording has been amazing. And I've been able to share the website, and they've learned more about providers. I see one of my friends who was a provider. I think she has a place on Carl Street. She just recently got 1 star. Ebony Bly is her name. Yeah. So I actually grew up with Ebony, and she just got 1 star. And I think she had tuned into our recording, and was sharing how supportive and happy she was with preschool promise. So Denisha, thank you. Eileen, thank you. Shara, thank you. Jerod, you're my mans. I appreciate it. And I want you all to look forward to other future discussions we have. We're working on something next week. Jerod, I ain't gonna expose it yet because we ain't got them confirmed, but hopefully we will. And again, thank you all. Thank you all. We will be sharing more information about how to join the All-In Cincinnati Equity Coalition. And one quick shout out. A friend of mine, Lawrence Kane, he actually made these shirts. They call it Invest in Black Women. I don't know if you've seen them. Invest in Black Women. I will connect you to Lawrence Kane. I mean, they're excellent shirts, and I love them.
And we will buy them in bulk. So if you
Lawrence, I hope you see this, brother. I hope you see this.
On that.
Hey, yeah. So I'm gonna share that with him. But he's a great guy. And Jerod, do you really quickly? We got 1 more minute. Do you know Lawrence Kane personally?
I do.
Can you talk a little bit about him? About what he does?
He's an amazing dude. So he actually started Abundance University. Lawrence recently, he's a teacher, he's a coach, but Abundance University is actually a financial literacy program that Lawrence started, and he brought it back to the community, right, in which we grew up in. So Invest in Black Women, he's a supporter. His wife's actually a teacher and educator. So, I mean, he's just a great all-around man. That's a very solid dude. So, he's an entrepreneur.
Certainly. So that Invest in Black, he's been wearing those shirts for a couple years now, and everybody buys them. And I didn't know if you all were familiar with them, so I'll definitely connect you all, and get some kind of thing going, because I know we want to support minority businesses. So Invest in Black women. That's the message, y'all.
Official T-shirt.
Yes.
I know, that's what I'm thinking. Yeah.
Invest in Black women. Okay, invest in Black women. Hey, thank you all for joining the discussion.
Thank you, Maurice and Jerod.
Okay?
Maurice, it's good to see you.
Always. Thank you.
Bye.
Bye-bye.
Bye.
Bye.